folks are still trickling in, but I have 1 p.m. Eastern, so we will go ahead and kick off today's call. Welcome back to another week of the Superior Health Nursing Home Leadership COVID-19 Roundtable. I know so many of you have been joining us week to week, and we're so grateful that you're able to carve out a little bit of time to spend with us and just kind of hear some updates related to COVID. So thanks again for being here today. My name is Kelsey Ostergren, and I'm joined by my program co-lead, Kim Haft, as well as Julie Campbell, who will be facilitating our Q&A at the end of the session. So today's presentation is part 2 of our 3-part series on immunization practices, and we will be hearing from Andrea Becker from the Michigan Department of Health and Human Services. She has let us know that she's having a little bit of internet issues, so we're just going to keep her camera off for today so that we can continue to get her audio through, and hopefully that won't be an issue for us. But if you do have any trouble, just feel free to send us a message or throw it into chat just so we can make sure everyone can hear okay. As always, just want to share a quick reminder that this is your session. We want this to be interactive. We want this to be engaging. So while we do offer some content and educational materials in sort of the first half of the call, really want to invite you to participate, think through questions, and raise any of that during the second half an hour when we turn to more of that open forum session. So anything that you want feedback on, support from peers, want to know how others are doing things, this is really your opportunity to get those questions answered and to ask those things. So as always, the slides for our session today are available. We will drop a link to those in the chat in just a moment. And we will also have an event evaluation form at the end of the session, which we welcome your feedback on as well. A few objectives for our session today. Andrea is just going to talk through some of the COVID-19 vaccine resources that are available, talk about both the vaccine confidence and hesitancy and how that really impacts what our outcomes are, and then how to have these conversations. Okay. And I really think that she will be helpful in facilitating some of this, providing a different perspective and some new guidance and resources that we'll be able to use moving forward. So with that, thank you all for being here. And Andrea, welcome. We're so excited to have you. The floor is yours.
Great, thank you. And I'm assuming you're going to bring the slides up.
Yes.
All right.
Just a second.
Good afternoon, everyone. My name is Andrea Becker, and I'm one of the immunization nurse educators with the Michigan Department of Health and Human Services Division of Immunization. And today I'm going to be talking about vaccine hesitancy and providing you with some tips on how to engage in vaccine conversations. Next slide. So to help build trust and confidence in the vaccine, providers and educators need to understand the recommendations and know where to find more information. So today I wanted to take some time just to review COVID-19 vaccine resources with you. And here you'll see an infographic that MDHHS created of the COVID-19 vaccination schedule based on CDC and the Advisory Committee on Immunization Practices recommendations. The schedule on this slide is for the general population. It also has been updated to include newer COVID-19 vaccine recommendations, such as the recommendations for those 6 months through 5 years of age, and then also the addition of the new COVID-19 vaccine Novavax. And this can be found at MDHHS's website by using the link at the bottom of the slide. Next slide. You'll notice that this schedule looks very similar. However, this schedule is specifically for those who are moderately or severely immunocompromised. So the one I showed you previously was for the general population, and this one is for those who are moderately or severely immunocompromised. And there is a link to this schedule at the bottom of the slide as well. Next slide. So here you'll see a screenshot of CDC's interim clinical considerations, which can be found at the link listed on the bottom of the slide. The considerations within this website apply only to the vaccine products currently authorized in the United States. So that would be Pfizer, Moderna, Janssen, and Novavax. These considerations were just recently updated on August 22nd to include guidance for primary series vaccination in adolescents using Novavax. And then they also reorganized the Janssen recommendations into an appendix. And so I would encourage you to take a look at that. And then this is the best resource really for clinical considerations in regards to COVID-19. And so we highly encourage you to bookmark this website and use this as a resource. 99.9% of the time, I can almost guarantee you that your question will be addressed within these guidelines. And for us here at the state, there isn't a day that goes by that we are not accessing this website for answers. So it's a really great resource if you have questions about COVID-19 vaccine recommendations. Next slide. And then MDHHS also has a web page with additional resources for safely providing vaccinations during COVID. This can be found at our website, which is www.michigan.gov/COVID vaccine provider. And this webpage includes things like a COVID-19 vaccination clinic preparation checklist, which can be handy for new providers who are just coming on. It also includes vaccine resource guides. These were fairly newly posted. So we have one for Pfizer and Moderna, and those are awesome resources when you're looking for the recommendations for those two vaccines. And then we also have our webinar information. So if you've ever heard our noontime knowledge sessions, all of our slides and recordings are posted there. It also has information about enrollment and vaccine billing, and then product-specific information, including the emergency use authorization fact sheets can be found there as well. Next slide. So now we're going to move into the main topic of today's presentation, which is vaccine hesitancy and communication. Next slide. We know that immunizations are one of the most effective preventative health interventions ever developed, and we know vaccines have saved countless children from death and serious disability. High vaccination rates not only provide individual protection, but indirect protection to a community and vulnerable persons that cannot be vaccinated. Most individuals receive all recommended vaccines, and very few go unvaccinated for all the recommended vaccines. However, we know that rates of vaccine hesitancy are increasing. Next slide. Vaccines have been very successful in decreasing vaccine preventable diseases over the years. And because of that, vaccines have really become victims of their own success, as we don't typically see these vaccine preventable diseases anymore. So it's more difficult to see the benefit of vaccination when you're not seeing the disease. And unfortunately, we are seeing some people who believe that exposing themselves or their loved ones to the disease is less dangerous than vaccinating them, even when the disease is visually right in front of them. And we see this even with COVID. So even though COVID-19 is circulating, they still feel that exposing themselves to COVID-19 is less dangerous than vaccinating against it. Next slide. Because we have seen concerns with hesitancy towards COVID-19 vaccines, we have found that education can help make a difference, and we know that how we say it matters. So now we're going to move into discussing a background on vaccine hesitancy, and then we'll move into some communication techniques. Next slide. So vaccine hesitancy or refusal is not new. It's been around for a long time. The World Health Organization defines vaccine hesitancy as a delay in acceptance or refusal despite the availability of vaccination services. And we know that vaccine hesitancy is complex. It varies across time, place, and vaccines. It includes factors such as complacency, convenience, and confidence. And to be successful in reducing the prevalence and incidence of vaccine preventable disease, vaccination programs really rely on high uptake for both childhood and adult immunizations. To help improve the current situation, we must define both the risks and the benefits of individual vaccines so that the public can understand the rationale for vaccine recommendations. And the key to regaining public trust in vaccines is a credible, consistent, and unified message developed from the private and public sectors that directly address public concerns. So unless an active effort is made to improve public confidence and trust in vaccination, there is a risk that the gains we've made in combating the morbidity and mortality of infectious diseases through the use of vaccines, that'll be lost. So next, let's take a look at what we know about vaccine hesitancy. Next slide. So the vaccine hesitant person is the person who might skip or delay some doses, or who may have questions or concerns about if all vaccines are really needed or if they're needed at a specific age. We know that many persons receive the recommended vaccines and that there's a small number of persons who absolutely refuse vaccines. The vaccine hesitant person falls into the middle of that. So you could consider them indecisive or unsure. They're not completely against vaccines or completely for vaccines. They could go in either direction. And because they do vaccinate, they consider themselves to be pro-vaccine. They do not consider themselves as hesitant. However, the hesitancy comes in when they want some vaccines, but choose to skip or delay others. So it's kind of like buying a bag of Chex Mix, but only eating the pretzels out of that. Or some individuals, they may want Tdap vaccine, but they don't want flu vaccine. Vaccine hesitant persons are oftentimes referred to as fence sitters. And fence sitters is much different than vaccine refusers. Fence sitters have questions and they just want to know more about vaccines so that they can feel more confident in their decision. It's good to remind ourselves that when persons or caregivers are seeking out information or have questions about vaccines, it doesn't necessarily mean that they won't vaccinate, but we need to see this as an opportunity to educate them. This is much different than when you're having a conversation with someone who completely opposes vaccines. It's unlikely that you will convince the anti-vaccinator. Therefore, our efforts to educate and encourage individuals can be more successful when we focus on those who are on the fence about vaccines rather than those who completely oppose vaccines. Next slide. In order to build vaccine confidence and encourage persons and caregivers to vaccinate, we must first understand what influences their confidence in vaccines. And this slide provides a list of factors that affect vaccine confidence. So these factors include concerns about vaccine safety, social media and news influences, concerns about vaccine effectiveness, and perception of disease risk. These influences are what make conversations with persons and caregivers so challenging. Next slide. And in addition to individual and caregiver vaccine hesitancy, we are also beginning to see more provider vaccine hesitancy as well, and particularly in the long-term care settings. During March of 2021, 300 long-term care facilities reported COVID-19 vaccination coverage for their healthcare personnel. COVID-19 vaccination was highest among their physicians, and you'll see that's 75% there on the chart, and lowest among their aides, which is 46%. This is concerning considering that they are caring for the most at-risk population, and even more concerning that those with the lowest coverage, so the aides, they have more direct patient care. Long-term care facilities actually have pretty good vaccination coverage among their residents. When CDC investigated an outbreak that occurred in a Kentucky nursing home in March of 2021 due to an unvaccinated symptomatic healthcare personnel, they found that about 90% of the nursing facility residents were vaccinated, but only 52% of the staff were vaccinated. And so some may ask, well, how does someone who is not vaccinated put a vaccinated person at risk? And during the same outbreak, 18 elderly residents and 4 long-term care workers developed breakthrough infections. 1 vaccinated resident died. And we know that there is no vaccine that is 100% effective, and we know that older adults may not build as good of an immune response. Therefore, they may be more susceptible to those breakthrough infections. And because of that, that's why it's so important to ensure added protection through vaccination of those who are caring for those high-risk individuals. Choosing to work in healthcare means taking on an added responsibility to protect people at high risk of severe illness and death from contagious diseases. Healthcare workers play a crucial role in promoting immunization programs, fostering vaccine acceptance in the community, and interrupting transmission in healthcare settings. And given the critical role healthcare providers play in stimulating vaccine acceptance among hesitant individuals and the frequency of the healthcare providers' vaccine hesitancy, failure to address healthcare provider hesitancy leaves immunization programs at a significant risk. So additional efforts are warranted to improve long-term care facility immunization policies and vaccination practices. We really want to build healthcare provider confidence in COVID-19 vaccines and encourage vaccination among persons who have been economically or socially marginalized. CDC and partners have prepared education and training resources to help educate healthcare personnel and promote COVID-19 vaccination coverage among long-term care facility staff members. Next slide. So now we're going to discuss how to have these vaccine conversations. Next slide. Talking about vaccines today is not an easy thing to do. It can be very challenging and very frustrating. Individuals will come to you with concerns you've never heard of, and you may feel unprepared to answer their questions. There could also be inconsistent messages in your office. So maybe you are recommending flu vaccine to all your patients. However, another staff person is telling patients that they got the flu last time they received the flu vaccine. So there's mixed messages going around. It's time consuming to have these conversations with patients, but it can also be very rewarding, and you can make a difference by engaging in conversation. Next slide. We know that what the provider says matters most. They are their most trusted source of information, and research shows that a person who receives a strong, clear recommendation from a healthcare provider is 4 to 5 times more likely to be vaccinated. Developing a trusting relationship with persons is very key to influencing their decision-making around vaccines. A recent study actually demonstrated that physicians reported the greatest success convincing skeptical individuals using messages that relied on their personal choices and experiences. So relating that they themselves or their family has been vaccinated helps provide a compelling message that they are confident in the safety of the vaccines. Next slide. A strong recommendation is important, but how we frame the conversation is also important. And some research suggests that it may matter more. The best predictor if a person will leave vaccinated is how the conversation is started. And this applies to both the hesitant and non-hesitant individual. A good recommendation is a simple, strong, and personalized approach. This is also known as a presumptive approach. So as you can see on the slide, we have 2 messages. The more presumptive approach is strong, and it leads in with, it's time for your flu shot. I recommend you get vaccinated today. I get vaccinated and my children do too. It's the healthy thing to do. The other example is known as more of a participatory approach, and it leaves room for opinions. So this approach starts by saying, research suggests that persons vaccinated with influenza vaccine have a decreased chance of contracting disease and complications associated with influenza. Would you like to get vaccinated today? So this approach can imply that choosing not to vaccinate is medically acceptable, and it gives them more options and more to think about. Whereas if you use the presumptive approach, you're telling them today it's time for your flu shot. I recommend you get vaccinated. So we're going to do that today. Next slide. And we know from research that parents refuse vaccine at a higher rate when using the participatory approach. So using the presumptive approach made individuals and parents feel that vaccination is what most people do, and that it is socially acceptable and that that's the norm. So now we're going to move into further discussion about communication techniques for the vaccine conversation, while also keeping in mind that a strong provider recommendation matters and the presumptive approach to vaccine conversations leads to better vaccine uptake. Next slide. So one of those communication techniques is motivational interviewing. Motivational interviewing is an evidence-based and culturally sensitive way to speak with unvaccinated persons about getting vaccinated. And the goal of motivational interviewing is to help people manage mixed feelings and help them move toward healthy behavior change that is consistent with their values and needs. Next slide. So I'd like to go over with you the 4 steps on how to apply motivational interviewing during a visit. So when you're talking with persons about vaccination, the first step is to embrace an attitude of empathy and collaboration. And you can do this by putting yourself in their shoes and being genuinely curious about the reasons why the person feels the way they do about vaccination. In trying to understand where they are coming from, it will help you to better address their concerns. Remembering to be sensitive to culture, family dynamics, and circumstances that may influence how they view vaccines. It's important that we avoid confrontation, as we know that arguing and debating do not work. Next slide. After listening to the person and hearing their concerns, the second step of motivational interviewing is to start by asking permission to discuss vaccines. So you could say something like, if it's okay with you, I would like to spend a few minutes talking about COVID-19 vaccines and your family. And the goal is to understand where they are coming from. It's not necessarily to change their mind. If the person says yes, then you would move on to step 3. And if they ask questions about vaccine safety, risks, or their health or mental health, then you would move to step 4. And so next, we're going to discuss step 3. You can go to the next slide. So in step 3, you want them to talk about their concerns out loud, because actually talking about it changes how they process their choices and can develop forward momentum. The slide gives an example of one way you could approach this. People hesitant about vaccines usually have more practice explaining why they haven't gotten vaccinated. So in this example, it shows how you can actually reverse this and ask them to express their vaccination benefits out loud. Get them talking more about the benefits versus why they don't want to be vaccinated. Again, it's important to be compassionate and curious about the individual's mixed feelings, both the part of them that wants to trust that getting a vaccine is important and safe, and the other part that feels hesitant. It's important to show support for the person, to incorporate their personal values and the health needs of their family and community as they make their decision. By doing this, you will be able to establish a relationship of trust, and the person will begin to feel more comfortable in discussing their concerns, and they may be more open to hearing about the benefits of vaccination, or maybe more open to getting vaccinated. Next slide. And then in the last step, step 4, you will respond to questions about vaccines. So if a person asks a question about vaccine safety, vaccine risks, or their health or mental health, then you would respond within the boundaries of your competence, ethics, and scope of practice. If you feel competent, respond with empathy and provide scientific information as needed. You can also refer them to resources if needed. If you are unsure of how to answer, or the question is outside of your scope of practice, then recommend that they speak with someone who is more knowledgeable on the topic and or help them find an answer to their question. Next slide. So CDC has a great resource online called the How I Recommend video series. And this series features short, informative videos from clinicians. They explain the importance of vaccination and show how to effectively address questions from individuals about vaccine safety and effectiveness. And a link to this resource can be found on the slide. Next slide. It's important to understand that all staff play a role in vaccine communication, and having a team approach to vaccination helps ensure that individuals are getting a clear and consistent message regarding the importance of vaccination. Ensuring that staff has access to up-to-date information on vaccine recommendations, access to clinical resources and trainings on vaccination, and answers to their own questions about vaccines is helpful. Healthcare providers who feel confident in vaccines are more likely to recommend them to their patients. Next slide. So now that we talked about a communication technique, we're now going to move into some common questions you might hear from persons and caregivers and how you might address those. Next slide. So our first question is, why should I get vaccinated if I might get COVID-19 anyway? And this is a question that you may have heard, or you might actually hear people say, well, I got vaccinated, but I still got COVID. So what was the point in that? A lot of people you'll hear that from. And one of the most important things that we need to stress when someone may mention that is that no vaccine is 100% effective. If you get vaccinated, yes, you can still get infection. And it's important to realize or understand that when you have been vaccinated, it significantly lowers your risk of severe illness, hospitalization, and death if you get infected. So even if you get infection, your chances of having severe illness or being hospitalized or dying from the infection is going to be a lot less if you are vaccinated versus if you are unvaccinated. So that's the important point to share if you have someone who's asking that question or mentioning it. Next slide. And this, I actually have it as with a question mark on there, but it's actually not really a question, it's more of a statement. But the COVID-19 vaccine might give me or someone else COVID. So you may have also heard individuals afraid that if they get the vaccine, it's going to give them COVID-19, or that they might shed some of the virus and it infect others. And so none of the authorized COVID-19 vaccines in the US contain any live virus vaccine. So it's impossible for it to make them sick and give them COVID. Some people may have some side effects after being vaccinated, and that's normal. So you may have like a low-grade fever, you may feel a little malaise or kind of crappy for a few days, and that usually ends after a couple of days. So you wouldn't want to confuse that with being COVID, because that is a typical normal immune response when getting vaccinated. And then vaccine shedding, a lot of people are concerned about vaccine shedding. And in order for that to happen, sometimes that can happen with certain live virus vaccines, like chickenpox vaccine, for example. If you develop a rash and someone were to touch that, there's a theoretical risk that that could transfer to somebody. So you would want to keep it covered up. But with the COVID-19 vaccine not being a live virus vaccine, it's not capable of shedding and infecting other individuals. So that's an important point to be able to share with individuals. Next slide. And then the next one is, I already had COVID, so I don't need to be vaccinated, right? Well, we know that if you have COVID infection, shortly after COVID infection, you do have pretty good immunity against being reinfected. But as the time goes on, your immunity starts waning after you've had infection, and you could become reinfected. We also know that there's different variants that are circulating. And so it's possible that the variant that you got, you become exposed to another variant that's different, and you could be reinfected with a different variant. And sometimes different variants might be more severe. And so it is still important for people who have had infection to get vaccinated. And vaccination, we know, is more consistently produces a protective immune response than infection. It offers a wider breadth of protection based on the types of memory responses that are produced with it. And studies have also shown that individuals who have had COVID-19 infection and then get vaccinated actually are showing better protection than if they were to just get vaccination or if they had infection alone. So if you have someone who wasn't infected and they got vaccination, they would have good protection, but someone who had infection and then also got vaccination may have a little bit better protection, is what studies are showing. Next slide. So just wanted to share this resource with you. CDC has a great resource to help promote COVID-19 vaccine in long-term care settings. And this resource provides information for long-term care administrators and managers, as well as state and local immunization programs. And a link to this resource is listed on the slide. So I would encourage you to check this resource out and just kind of get a feel for some of the things they have on there. It's a great resource for long-term care settings. Next slide. It's really hard right now to not make COVID-19 our only focus. However, it's really important that we don't forget about other routinely recommended vaccines, such as flu and pneumococcal. Vaccination status of persons should be assessed at all clinical encounters, even among clinicians who do not stock vaccines. Identifying vaccines that the person needs and clearly recommending and offering them to the person is important. And if you don't carry the vaccines, referring the person to another provider or location for vaccination is helpful, and then also assisting with scheduling transportation if necessary. So we just want to make sure that adults are aware of all of the vaccines that are recommended to them and that those are offered to them as well. Next slide. So this is just a summary slide of everything that I went over with you. And it's important to remember these strategies. So it's important that we have a consistent immunization message across all staff so that there aren't any mixed messages like we talked about. Knowing and providing credible resources to help educate. It's important that we're being respectful and listening to their concerns when they have concerns about being vaccinated, and we help walk them through that. And then practice using the 4 steps to apply motivational interviewing, taking a strong position. So as we talked about, providers are the most trusted source, and persons are more likely to accept vaccines when using a presumptive approach. Focus on educating those fence sitters as opposed to spending more time on those who completely oppose vaccinations. And then assess for and strongly recommend all recommended vaccines. So those are strategies to remember, or kind of the takeaways from today's presentation. Next slide. And so I want to thank you for having me come and talk with you today. This definitely is not an easy topic to discuss, and vaccine hesitancy definitely is out there and it's real. And we just need to be, good educators and be able to be open with people and try to understand where they're coming from when we're having these conversations, because they're not easy and sometimes they can become a little heated even at times. But it's important to just tell individuals what you know. If there's something that you don't know, getting back with them or referring them to somebody that knows is really helpful. So I just want to thank you for your time today and thank you for having me. There is an email on there if you have questions that you can send to us, and then I'll open it up now or send it back in case there are any questions out there for today.
Thanks so much, Andrea. That was a great presentation. So many resources in there. And I feel like it's such a timely topic as people are continuing to have all of these conversations around vaccines, and people probably have a lot of different concerns. So thank you so much for the information today. We really appreciate it. Like Kelsey mentioned, this second part of the call is really time for you all. It's meant to be very discussion based. So we will still have Andrea on the call. So we'll go ahead and open it up. Does anybody have any questions for Andrea just to get us started off? And you can go ahead and use the chat box. Sometimes it's a little easier just to unmute and go ahead and ask your questions. So either or. Any questions? All right, well, while you're thinking about those, oh, Kim, I just saw you unmute. Did you have something you wanted to add?
No, I was just going to repost the slide deck. It's all good.
Okay, perfect. Yep, thanks for doing that. And I saw there were a bunch of resources linked at the bottom for kind of all those frequently asked questions. So go ahead and check out the link that Kim's going to post in the chat. And thanks again, Andrea, for those resources.
Sure. And I'll just mention too, with that slide set, especially if it's coming across as a PDF, you'll be able to click right on those links that are throughout the presentation. So on each of those slides, you should be able to click on those links and bring those resources up.
Perfect. Thank you. All right, so for our nursing home leadership that we have on the call today, I'm kind of hoping we can use chat for this first kind of discussion question with all of you, and then move to some verbal discussion too. But just to take a quick pulse, if you want to drop in the chat, do you see this issue of hesitancy as a barrier to COVID-19 vaccine uptake at your facility? Just go ahead and drop like a quick yes or no in the chat. That would help to kind of just get a quick pulse check. All right, seeing yes. All right, so yes, no, yes, mostly for staff. Yeah, great point. So any hesitancy that you're seeing either for residents or for staff? And it looks like we do have some yeses. So for those of you who are seeing hesitancy as a concern, what are some of those common concerns that are coming up? What are those questions that people are asking? I think if you're hearing certain questions and concerns, there's a good chance that somebody else is hearing those, and we can kind of brainstorm how best to address those together. So what are some of those common concerns that you're hearing from residents or staff? You know, Andrea had gone through some of those frequently asked questions kind of at the end of her presentation. So any of those that you're already hearing, or any in addition to those questions or concerns that you're hearing at your facility? All right, do see one comment in the chat. Jamie said, I think we'll have more acceptance when the Omicron vaccine is available. Okay, so the next round of boosters that we're expecting in the fall. Any education that's going on around that next round of boosters that anyone has seen be helpful? Are people starting to ask about that next round of boosters? All right, one comment from Angie, that they still have to wear masks, that vaccinated staff and residents have still tested positive, and essentially that they haven't seen the promised reduction in the all COVID prevention measures in nursing homes. Thanks for that comment, Angie. Anyone else seeing similar concerns, or if you have any ways that you're talking with staff about those concerns, maybe offering resources? All right, we got a comment from Elizabeth, kind of seeing the same thing as Angie. Another comment from Jamie, FDA announced today that Omicron vaccine is approved. What about this? Go ahead, Kim.
I'm sorry, Julie. I just wanted to put out there, Kelly, I'm interested. You initially had said that you haven't been seeing any hesitancy in your nursing home. Boy, I would love to hear, and I'm sure the participants would. Why do you think that is? Was it due to your vaccination campaign program, where the area you live in, your demographics? What do you think contributed to such a success that you don't really have the hesitancy in your nursing home?
Hi, so I think a lot of it's the community we live in. It's just kind of almost an expectation more than an offering. There's been a little more hesitance with staff. When we first did the vaccine, there was a lot of hesitancy, but over time, most of our staff have, even the ones that had medical or religious exemptions at the beginning, have gotten the vaccine since then. The residents, it's not really even a question. They just kind of expect to get it. So we only have a handful that haven't. So I think it's more the community expectation. I don't know.
Yeah, thank you for that. I talk to a lot of nursing homes, and one of the questions I usually do ask is sometimes it's just like, where do you live? Are you rural? Are you urban? You know, trying to get a little background on where the nursing home is and comparing that to vaccination rates.
Yeah, we're like a small city, so it's probably not a big city, but probably more middle class. So
Are you
a lot of it.
I'm sorry, just one other question is, are you in, what state are you in?
Wisconsin.
Wisconsin, okay.
This is Andrea, and I just wanted to pipe in and say that wanted to verify that the FDA did authorize the booster earlier today, and ACIP will be meeting tomorrow and Friday. That's the Advisory Committee on Immunization Practices. So that's CDC's advisory committee, and they will be meeting to discuss that and make recommendations. And so depending on their vote, and if the CDC director approves that, we should see those fairly soon. So I just wanted to follow up with that.
Thanks for sharing that, Andrea. I think the other thing that both Angie has mentioned as well as Jennifer in the chat, about sort of like the implications of being vaccinated, right? And when you're doing something that you think should have some positive benefit, whether that being I'm not going to get COVID, or this means I don't have to test, or well, then, soon we won't have to wear PPE all the time, right? So when you sort of have that goal, if you will, of, if I do this, then this is supposed to happen, or I anticipate this will happen, and you don't see that immediate, change or response, I think it can sometimes be difficult to say, okay, well, I did this and it didn't really seem to help, or nothing has really changed. So, maybe I did still get COVID, right? Like, and trying to work through some of those, I think, nuances can be challenging, right? And the other point that Jennifer made that I think is spot on, right, is about people who get COVID, even though they've been vaccinated or they've been boosted. And for those of you who were on our call a few weeks back when we spoke about the BA.5 variant and some of that data on what we're seeing with, people being infected, even though they were vaccinated, just because we're seeing different strains in our current vaccine isn't as effective at protecting against these new variants. I think that is, part of why this is happening, right? And with the conversation we were just having about these new Omicron boosters, I'm hopeful, as others have mentioned in the chat, that we will see some uptick of people being receptive to that and wanting to have these conversations. So in my mind, I think, this conversation is very timely on the heels of this new booster being approved and us sort of getting ready and preparing for potentially an additional round of conversations with our staff, with our residents, about kind of what this means and how is it different. And, at some ways it feels like, at this point in the pandemic, we're kind of beating a dead horse about, COVID vaccines. And, you understand the people who are or are not willing to, get vaccinated or have some of these conversations, right? But I think this sort of opens a new door for us to start those conversations. So Andrew, I'm really grateful that you were able to share some of your perspective in these resources and talk a little bit more about motivational interviewing so that we can prepare and do our best to get ready for, these Omicron boosters in the coming weeks.
Yeah, and I just want to say, kind of to bounce off what you said, it is really difficult, and especially kind of earlier on in the pandemic when people were told, you get vaccinated, then you don't have to wear a mask anymore, all those certain things that you're kind of expecting to change. And it doesn't change. And one of the things that I think is kind of important to understand with this whole process that has happened is that, we're learning, everybody's learning as we go. So maybe at the beginning, let's say if everybody got vaccinated when they were supposed to, everybody wore a mask when they were supposed to, we didn't have anybody that wasn't wearing masks, that sort of thing could have possibly had a greater impact on what we were seeing with COVID, and it could have changed things a little bit, possibly, right? But we know that that's not going to happen. There's no perfect world where all of that just goes exactly how planned. And so when more of the infection spreads and then we develop these new variants and then recommendations change. So the recommendations were continually changing because of what we were learning. And because it was in real time, it wasn't something that we had this all planned out. We knew exactly how it was going to go, and we know exactly how to handle it. And so I think that's where it's a little difficult, when people are expecting things to change, because we're kind of saying that because that's what we're hopeful for. And we're hoping that by people doing these things, we will be able to do that. But then now we find out more information and, well, we can't quite do that yet because of these things that are happening. So I think, understanding that we're learning as we're going is an important thing. And I know you guys mentioned in the chat too about the question I went over about people feeling like, what's the point in getting the vaccine if I'm going to get infected anyway? And that was one of my questions, and it's huge. I mean, we hear that all the time, and people just don't see the value in getting it if you're still going to get COVID. And we just have to keep trying to educate them that even if you get COVID, you're less likely to have severe disease if you're vaccinated versus if you're unvaccinated. If you're unvaccinated, you're more likely to have severe disease or possibly end up hospitalized or even dying from COVID. So that's really the important takeaway. And we know that vaccines aren't 100%. Even when we come out with this new booster, it's not going to be 100%. There's going to be people who still get infection after being vaccinated. But the good thing is that we know that these vaccines are very protective against serious illness. And that's, I mean, I can't stress that enough. And even in my personal life, people I talk to, you know, I try to tell them that sometimes you'll get through to people, sometimes you're just not going to, or they don't really understand that or realize it. But it's very similar to flu vaccine. Flu is the same way. Flu viruses change every season, you know, that they mutate and they change. And so they have to meet to try to determine what strains should be covered in the flu vaccine every year based on what's circulating in the community. Sometimes what they pick to be in the vaccines is a good match to what we see circulating, and it's going to give pretty decent protection. Sometimes it's not a good match. But overall, we know that with flu vaccine, even if you get influenza after being vaccinated, it's much more mild, and you're less likely to have that serious disease. And so flu and COVID are very similar. And I think eventually, as we progress in this pandemic, you will start to see that COVID-19 recommendations will probably be fairly similar to flu. This is just my assumption or guess, but it might be something that becomes like an every year thing because it is a virus. It mutates. It's going to continue to mutate as long as it's circulating. So just some more additional information to kind of give thought to.
Andrea, I really like that you mentioned how important education is and ongoing education and kind of keeping these conversations up because we are learning about all of these things together as we go along, and especially as new recommendations come out. So I wonder, Andrea, I don't know if you've heard of any helpful strategies for education or for our participants today. Are there any strategies around education and kind of giving all of these updates to your teams that have worked well? Is it one-on-one conversations? Is it staff meetings? What has been working?
You know, from like a facility standpoint, I mean, just really probably the biggest thing is making sure that they have updated resources, updated recommendations. How you share that is going to differ, you know, from different health system or place. Whatever's easiest for them, I think, you know, is what they should try to go with. As far as with staff, because we know that long-term care facility staff have lower vaccination rates. Sometimes those one-on-one conversations, you know, may be more successful versus having them all as a group and educating them. Or you may, you know, give education in a group, but then you may want to talk to some of them individually. So I know in Michigan, we have, you know, for our schools, if we have kids who are waiting vaccines for schools, they're required to go into the local health department for one-on-one education. The parents are, they go into the health department and they have one-on-one education. And we have found that to be successful. So we know that helps, and it offers you a chance if you're meeting one-on-one to be able to approach them with that empathy and really, you know, try to figure out what it is that they're concerned about, so that you can talk about those concerns. And like I said, there's going to be people who are just completely opposed to it. You can't even talk to them. They're so opposed to it. And those aren't necessarily the people you want to spend your time with, unfortunately, just because changing their mind is going to be really difficult, or changing their viewpoint is going to be difficult. And so really you want to focus on those individuals that just have more questions and they're just really hesitant about it and they're unsure. You know, it's like they want to get vaccinated, but they're a little nervous, and they're really unsure if they want to go through with it or not. And they're really trying to weigh those benefits and risks. And so by someone being there and helping them with kind of sorting through their feelings and what their feelings and giving them more education, that can be helpful. And so I think that's why the one-on-one approach is good. But I also think that keeping people informed overall with the changes in the recommendations and things that are coming out, and educating them through other means is just as important. So whether you have a newsletter or you send out a listserv message to staff, or you have a webinar, or maybe you know of a webinar that's coming up that you can tell them about that they can join and learn more. Those sort of things are also very important.
Thanks, Andrea. I like that you mentioned kind of a multifaceted approach, and it kind of, I'm sure, depends on how people are comfortable and how people learn best. So kind of keeping that information up to date in the facility, using those newsletters, bringing people together to talk about things in a group, but then also if people may not feel comfortable bringing up their questions in front of an entire group of people. So I really like that you mentioned kind of the power of those one-on-one conversations and really employing those motivational interviewing techniques and expressing empathy, kind of keeping the conversation going. I want to open it up though too to our participants. Anything that you're seeing in your facilities that has worked well for kind of getting that education out there? Updates are always coming out. So anything else that anyone wants to mention that's working for them?
So in chat, Angie had indicated that that we need to be looking for a more realistic and sustainable way to address positive cases that will continue to happen at our facility, similar to what we've seen with influenza. Perhaps there could be incentives for those facilities that have achieved good vaccination status among their staff and residents, and that could be motivating, could be a motivation for vaccination. And she asks if there's anything on the horizon. Not that I personally know of, but I am curious, when you say incentives, when incentive, that word comes to your mind, what does that mean to you? What do you think that incentive would be that would be motivating? What kind of things do you think your staff would want, or your nursing home corporation? What does that mean to you? Is it money? If you have like 100%, you get a bonus for your nursing home. Is it recognition in the newspaper? Is it, I don't know, what does that look like? Oh, wait, okay. For our staff, it would be, there you go. Okay, it would be less PPE. For our residents, it would be being able to be together with their peers as outbreaks do impede this. No testing, no quarantine. That's nice.
Yeah, and I don't know of anything necessarily on the horizon for those types of things at this time, but I also don't work in communicable disease, who handles more of that, making those decisions on quarantine and isolation, and when we can maybe stop wearing the masks all the time and going back to what we did before. So but I can definitely see how that would help incentivize not having to do those things and getting kind of back where we were. I think eventually we will get there, but it's taking time, unfortunately, in learning about the virus. We've already seen some changes, with isolation recommendations and quarantine guidance too. So I think eventually we will have more changes to that.
Yeah, please note Angie's last response. I like that. Of course, she's not talking money, not saying no to PPE or testing or quarantine, but rather a more of a risk benefit approach. Makes sense.
I know we have a few minutes left. And I did see one other thing come through the chat, and it made me think of Andrea, when you were talking about not only talking with patients, but talking with their families. We had a comment in chat about seeing some refusals from residents or their family too. So I wonder, Andrea, if you have any recommendations or participants on the call today, are you doing any outreach to residents, like family members, caregivers? What do those conversations look like? And maybe any strategies that have worked well for talking with family members too about vaccines?
Yeah, that's a good question. Not off the top of my head, can I think of anything in particular that we are working on right now as far as reaching those populations? A lot of our education is directed to providers with many of the different things. So I'm trying to think of something specific that we might have for long-term care, and it's not coming to me right off the top of my head. And we have individuals who actually specifically work on long-term care too, so they would probably know more than me on what things we have available. But just being open with them and willing to communicate and using the strategies that we talked about today with the motivational interviewing, see what concerns it is that they have, provide them with any educational resources, which you can find a lot of those on CDC. I'll tell you another good place for educational resources is the Children's Hospital of Philadelphia. Although sometimes those are directed more towards kids because it's a children's hospital, but they do have good explanations for different questions that come up, and they have a whole slew of library of COVID-19 questions that have come up and how those can be addressed. So utilizing resources like that. Immunize.org is another great website that has some stuff as well. But I would just suggest, if you have someone who's refusing, trying to see if you can have a conversation with them. And if you can, try to find out what their concerns are and provide them with some education or resources to them to help them with their decision.
Thanks again, Andrea, and great ideas for where to find more resources too. I know we're getting close to time here, but there was one more comment that came in the chat from Jennifer. I think this is a great one. We know this is going to stay around, so we need to find a way to live with it that also allows people, especially our residents, to live and enjoy life. So I think that's a great comment, and really thank you all for all that you're doing to keep these conversations up and keep sharing this most up-to-date information. Any additional questions for Andrea or any of the Superior Health team with our last couple minutes left? Otherwise, Kelsey, I can go ahead and turn things back over to you.
Awesome. Well, hearing none, thank you all for your participation and your engagement in our call today. I have put up a slide with our 2 upcoming sessions, so we hope you'll be able to join us for part 3 next week of this series. And then Dr. Buffy will be back on September 14th to do her last and final part of her 5-part series. So we have those 2 coming up. We did put the link to an evaluation in the chat box, as well as the slides. So if you haven't, before you disconnect, just take a minute to click on both of those so you have them and you can complete or download the slides after we disconnect. So with that, we will end today's call. Thank you all for your engagement and participation. And Andrea, thanks so much for your wealth of knowledge and all of these resources you shared. I think this is a treasure trove of stuff that we'll certainly keep referencing back to. So thanks everyone, and have a great Labor Day weekend if we don't talk to you before then. So take care.
Bye, everyone.
Great. Thank you.